The last comments about exercise.
Dr. Mittal, there's been a lot of interest on exercise in the recent times. And it's obviously, due to the events which have happened recently.
Yeah.
I think I'm going to be very practical and put it into 3 buckets because nobody needs to be scared about exercising. In fact, we would encourage the whole nation to exercise. It is the single most important method to decrease the incidence of heart attack, which is in everyone's hands, without doing anything extra. So that's very important to understand. And the recommendation for heart health is very clear, that we have to at least 150 hours, but I would even say go up to 200 hours, which means 40 minutes, 5 times a day.
So 150 minutes.
150 minutes per week.
Yes.
Which is 150 minutes per week, which actually means 40 minutes.
Maybe
40 minutes 5 times a week at least of aerobic exercises, which to us is brisk walking, cycling, light jogging, are all good. Or you can have a combination of aerobic and aerobic exercises. You can actually also do mild weight lifting, etc. And then, of course, you don't need to do your 200 minutes a week. You can actually accommodate that in 100 minutes a week. But that is the heart-healthy exercise. This decreases the incidence of heart attacks clearly by 15 to 20%, improves on your weight, controls diabetes, controls hypertension, does all the right things, and gets rid of most of the risk factors for heart attacks. That is the reason why it's so important. The important aspect is, what about, people ask me, what about if I do 50 minutes? What about if I do 1 hour? Can I do 2 hours of exercise? Yes, you can absolutely build yourself up to 2 hours of exercise, but what that does is improves your stamina, maybe weight loss. If your aim is to lose weight, it actually would make you spend more calories. It'll improve your stamina, it'll improve your well-being. Is bodybuilding bad? No, it isn't. Is extreme running or 10 kilometers running or 15 or 20 kilometers running bad? No, it isn't. If you gradually build up yourself to that level over a period of time that you can actually do it, all are safe provided you build up over a period of time. That's the whole bottom line to it. What is going to be bad is the third, unaccustomed level of severe exercise suddenly that you undertake without having built yourself up to that stamina or level, or your heart having built up to the stamina level. So what you see, and what we see sometimes, and certain collapses which happen, by the way, all the collapses and the things you see of somebody dying on a field or a football field, all those visuals, are probably related to congenital heart abnormalities which existed, which weren't diagnosed in those patients. So don't think that everybody's dropping because of a heart attack all around. And the second aspect is clearly that unaccustomed level of exercise in someone who's probably had hidden or occult coronary artery disease and goes through severe exertion of some sort, which he's not been accustomed to, can precipitate a heart attack. But those are unusual and rare cases, and that is why we should not just as a public start believing that we're all at a risk and ready to die the moment we exercise. In fact, we believe that the whole nation should be exercising, and it's in your hands to decrease the heart attack in this country.